So Olliers disease is a skeletal dysplasia. That means a generalised problem of the skeleton, and it can affect many bones in the skeleton, although one of the funny things about Olliers disease is it tends to affect one side of the body more than the other for reasons we don't quite understand. And in Olliers disease, the bone, parts of the bone tends to get replaced by masses of cartilage. And the consequence of this cartilage in the bone is that you can get some shortening of the limb, and you can actually get some deformity. And Olliers disease can actually produce very significant shortening in the leg, sometimes as much as 12 or 15 centimetres we've seen in the past. But it's variable in severity, not all patients have exactly the same amount of problem. Now, normal management of Olliers disease these days is to deal with the deformity and the leg length difference, which we can do by a process of leg lengthening. This needs to have an external fixator, a frame attached to the leg. We cut the bone and then we just stretch it, and the bone will grow in the gap. And one of the funny things about Olliers disease is that even if you cut the bone through an area of cartilage, in most patients normal bone forms in the gap, which tells us a little bit about the way in which bone forms when we're doing leg lengthening. Clearly the process of formation is different from the defect that we have in Olliers disease. Olliers disease, although the deformity and the shortening can be quite severe, it does actually respond reasonably well to leg lengthening, provided it's done in specialised centres, and we've been able to get some quite satisfactory corrections on many of our patients.